Hello everybody, good afternoon. Welcome to our webinar introducing the Maternal and Women's Health Business Unit. The webinar today will last approximately 1 hour and we will be going through the following points. The introduction to the product portfolio for the Maternal and Women's Health Business Unit. We will be going through where the business opportunities are for you in EMEA. Who are the right stakeholders to visit? What are the best market segments to cover? And then we will also go on to give some product training on our SensPoint lactate analyzer, the Chromatocrit Plus analyzer, pregnancy tests, and then we will be going on to give a brief overview of some products we have for diabetes screening, including the CoLab analyzer and beta-hydroxybutyrate chemistry reagent. And then to finish, we will be talking about marketing support we can offer throughout 2015, and then we shall take a quick Q&A session. If you have any questions, please feel free to ask a question using the control bar on your right-hand side. There will be an option there to send us a question. So today, Simona Carnielli, who's the Business Unit Director, she will be introducing the theme and going through the opportunities for EMEA and the stakeholders, and we'll have Katia Lemberg, who will be going through product training for the SensPoint lactate analyzer and Diaspect, and then we will pass to Diane Marshall, who will give you some product training on Chromatocrit. So without further ado, I shall pass over to Simona Carnielli. Thank you for attending. Over to you, Simona.
Yes, okay. So good afternoon to everybody and welcome to the EMEA educational webinar for our distributors. My name is Simona Carnielli and I am the Business Unit Director for EKF Maternal and Women's Health Business Unit. The agenda for today has been split into two different parts. The first part, as my colleague Luz announced, will be a business overview essentially. So I want to give you an introduction about EKF Diagnostic Group, an overview, and why the organization has been split into a different business unit. I want to talk about the mission and vision about the Maternal and Women's Health Business Unit. I want to give you an update about the organigram and talk about my team that will be focused on the needs of our distributors. I want to give you some instruction about which are the stakeholders to visit in order to be successful and which are the market segments to cover in order to be successful altogether. I will give you some numbers in terms of where are the business opportunity for Europe, Middle East and Africa, and within the group I want to share also a successful business model that was implemented just 1 year ago by our French distributor. And then I will share some marketing collateral available. I want to share with you some events and initiatives, and then the second part of the webinar is just on product training. So let's start with the business overview. EKF Company has been established some time ago, has been established in Germany in 1990, and at the moment is the result of a series of acquisitions that has been done from 2000 until last year. So the EKF group is a medium-sized group with 12 locations worldwide, and 8 of these 12 locations are manufacturing plants. With the new employees, I think at the moment we are close to 400 people in the world. And all the people are an experienced pedigree in diagnostic market. Our vision is to offer point-of-care testing able to guarantee easy result, easy to use point of care in order to improve the patient outcomes and reduce healthcare costs. The EKF New Structure, as you can see, has been divided into different business units because at the moment we are managing a huge portfolio of products. And the reason why is to make attention and be successful on specific market segments. So we have the business unit for diabetes care, we have the business unit for hematology, we have this one for maternal and women's health, and another one dedicated to central lab. For EKF Maternal and Women's Health, the mission is to improve mother and child outcomes by providing physicians and their patients innovative and complete diagnostic solutions with accurate and timely results anywhere, anytime. The vision is to be a premier healthcare provider on maternity and women's health care in every community and country that we serve. My team is composed by myself, that is of course the business unit director, and my responsibility is to lead the strategies and tactics of the maternal and women's health business unit by empowering my distributor channel with a successful solution for selling more altogether. And I have also a global product manager, Nunzio Cicatiello, that will help me to lead the global marketing activities in order to support entirely your needs. And then we have different business segment manager that will be more sales oriented, and the EMEA sales business segment manager will be someone to support you on the field for the education, for the training, and for all the other business excellent activities for all the sales distributor people in order to improve the long-term partnership with the best EKF distributors. But a distributor, to be successful for the maternal and women's health, what kind of stakeholders they should visit? The salespeople of a distributor should contact the obstetricians, the pediatricians, the neonatologists, the gynecologists, and the midwife. And every day should be someone that should visit public, private, university, hospital, and talk with the gynecologist, with the obstetrics, with the midwife or the maternity ward, talk with the gynecologist, obstetric, neonatologist, pediatrician of emergency department, or go and talk with the staff of the neonatal ICU, including also ambulance. Should talk and cover and visit stakeholders of private and other obstetric clinics. Should talk and cover with gynecologists and physicians private practice, and in some countries there are also opportunities into pharmacies. Which are the drivers for maternal and women's health? The world markets for women's health diagnostics as forecast for 2013 and 2015 are showing a strong growth of double digit. So, in any case, there are some opportunities to gather. The women's health arena, both therapeutics and diagnostics, has shown considerably a big growth in the last 10 years. And before was just limited to obstetric and gynecologists. Now includes other fields such as urology, maternal fetal medicine, as well as autoimmune disease and cystic fibrosis. And however, don't forget that the life expectancy of women is longer than men. The focus of maternal and women's health will be on diabetes, because gestational diabetes mellitus is a problem, because it's a problem, the diabetes type 1 for children and young women, together with the women type 2. The other focus is on anemia. Anemia is a huge problem for pregnant women. And also don't forget about the maternal health care in the developing world, where bleeding in connection with childbirth contributes significantly to maternal mortality. Don't forget about the anemia screening for children in context of malnutrition and the hemoglobin monitoring for HIV, malaria, and tuberculosis patients. The other third focus, not in terms of priority, but just in terms of the slide that I'm going to explain, is the lactate, because labor dystocia is a common worldwide obstetrical problem in both developed and developing world. Differences in myometrial lactate in women can lead to accumulation of extracellular lactate, which will reduce the myometrial contractions and could therefore contribute to dysfunctional labor dystocia that in most of the cases are solved with C-surgery, C-section. And then there is the preterm delivery birth that is a leading cause of infant death. Moderate to severe anemia in the first trimester together with gestational diabetes are common causes of preterm deliveries. And in terms of nutrition, reports suggest that preterm mother's milk should contain constant amount of lipid, fat, and calories for preterm babies. And we have a fantastic product, a unique product that later Diane Marshall will give you all the detail to sell it. Now let me give a couple of minutes to introduce also the product portfolio for maternal and women's health, because we have point-of-care testing dedicated to the conception and pregnancy, because we have pregnancy test, we have collab echo test for the gestational diabetes mellitus, we have DiaSpect-TM and hemocontrol that are point-of-care for monitoring of hemoglobin for anemia, and we will have at the end of the year a new product, a rapid test for PKU. I want to remember that high level of PKU is really dangerous for the new birth, because PKU, the level of fetal ketonuria, should be monitored before and during the gestational period. In case of high level of fetal ketonuria, the baby risks to have huge problems with heart disease, with encephalitis, and general growth retardation. And for the birth and pre-birth medicine, we have a series of point-of-care dedicated to the measurement of lactate at the time of birth, Lactate Scout, and the new device, SensPoint, that will be CE mark in the first half 2015, and BioSense for the monitoring of lactate and glucose. For post-birth, we have Chromatography Plus, this centrifuge to calculate the fat and calories of the mother milk, and PKU is the new device that will be available at the end of the year. And for general health, anemia testing, and diabetes for women and child. But now we talk about a series of point of care, but I want to clarify with you that are listening to this webinar where we need to sell this product. So Lactate Scout and SensPoint are EKF device for the measurement of lactate at the time of birth that could be sold into the delivery and labor world. Chromatography Plus could be sold into the neonatal ICU for the measuring of fat and estimate the calories of the mother milk. Pregnancy test could be sold into emergency department, gynecologists' private practices, pharmacies to test HCG. BioSense CES line could be sold into gynecologist department of hospital clinics or gynecologist private practices for monitoring of gestational diabetes mellitus. DiaSpect hemoglobin TTM device could be sold into the maternity ward for the measurement of hemoglobin in case of anemia for pregnant women. StatSite BHB ketones is a rapid test for the measurement of ketone, and exactly the beta-hydroxybutyrate that is the ketones quantitative most relevant, and could be sold into emergency department of hospital for the measurement of ketones in case of suspected DKA for children. CoTest Collab, our device, could be sold into gynecologist department of hospital, clinics, or gynecologist private practice for the monitoring of gestational diabetes mellitus. But where are the business opportunities for EMEA territory? SensPoint, Lactate Scout, Chromatography Plus are based on the number of new births, because more newborn we have, more we can sell. And in the slide, I showed the number of new births in last year, in 2014, in EMEA, where in total we have 56 million of new births. Most of them, of course, happen in Africa with 40 million, in Europe 8 million, and in Middle East 7.2. But where are also the business opportunity for lactate, which is the market size for lactate. The market potential for lactate is based on the proportion, again, about the childbirth that we saw in the slide before. And as shown in the graph attached, the causes of newborn death, the global data for year 2013 continue to show that intrapartum related to complications represented 24% and complications for preterm birth represented 35%. So it means that we need to adapt, together with the echographic and all the other clinical evaluations, something able to monitor these kind of complications. And this is the reason why we are offering to the market a device for the measurement of lactate. Consider that 40% of all births are first-time mother. All first-time mother will be tested twice for lactate. The first
Hello?
on just to check the level of lactate. The second is to check the comparison with the first one. The 40% of all first-time births lead to dystocia or difficulties in the childbirth process. In these instances, further monitoring will be required and an additional 1 or 2 tests on lactate will be performed during labor. In case of hypoxia, where the oxygen is missing to the baby, the 40% of the new birth will be tested on cord blood. It means that 1 or more SensPoint devices should be placed into the maternity labor ward, together with immediately later also into the neonatal ICU. High level of lactate in amniotic fluid and blood in the literature have been shown to be associated with decreased oxygenation of uterine tissue, prolonged labor, and increased the risk of adverse maternal as well as neonatal outcome that require urgent intervention such as forceps, ventus, and in most of the cases cesarean section. Where are the business opportunities for Chromatography Plus? No pregnant woman, of course, expects that his baby to wind up into the neonatal ICU, but every year between 7 up to 50% of newborns went to neonatal ICU for different reasons, including prematurity, heart problems, birth defects, breathing irregularities, and infections, even if likely 98% survive. Again, severe anemia in the first trimester together with gestational diabetes mellitus are common causes of preterm deliveries. And like we said before, it is important to guarantee the sufficient quality of the mother milk for the preterm babies that are going into the neonatal ICU. It is important so to educate the neonatal ICU to switch the value of the quality versus the quantity. For pregnancy test, the pregnancy HCG market size in EMEA was shown in this World Bank report that count 21 million pregnant women. For anemia market opportunities, there are this graph of EMEA territory from WHO malnutrition report, where you can see on the left side the anemia prevalence in pregnant women, and on the right side the prevalence anemia in preschool age children. For the diabetes market, gestational diabetes mellitus, the range of prevalence of GDM is up to 50% of pregnant women in the world. In case of gestational diabetes mellitus, the consequences are increased preterm deliveries, C-section, miscarriage, and admission to neonatal ICU. On the right side, you can see the number of people affected by diabetes, 56 million in Europe, 35 million in Middle East, and 20 million in Africa. And the range of diabetes type 1, consider that this affects children and young people in the percentage of 10 of the whole diabetic population. Now we are close to my part, but before closing, I want to share a successful business model implemented by the French distributor. The name is Natec, and Natec was really successful last year because the strategy is really to focus into the maternity care market segment. Every day the salespeople of Natec are visiting, interviewing stakeholders that are gynecologists, obstetric, midwife, pediatrician, neonatologist. And last year they growth for 101% in comparison versus 2013. From 2013, Natec were able to convert 19 maternities, and 6 more will be converted by the end of March 2015. Converted, I mean that the salespeople of Natec were able to convince and to place the lactate meter into the maternity ward for the monitoring of lactate at the time of birth. And also, lactate meter, it's something where we can help the hospital to decrease the healthcare cost, because the level of lactate at the time of birth also can show if the pregnant woman needs or not a C-section, because the tendency, the trend of the market is to ask even more for C-section. And this is costing a lot of money for the hospital. So Natec also did an impact study last year where, using the lactate meter, they were able to decrease the cost of the hospital for 9% because they decreased the amount of C-section in the hospital of Angoulême. The products sold by Natec are Lactate Scout into the maternity ward for the measurement of lactate at the time of birth, DSPAC-TM for the measurement of anemia in pregnant women into the maternity ward, and Chromatography Plus for the measurement of fat and calories of the mother milk into the neonatal ICU. We produced, just last week, new marketing collateral. We produced a new folder dedicated to maternal and women's health, where inside you can find the product flyer of each product that is part of the product portfolio. So I hope it will be useful to demonstrate all the product portfolio that we have for maternal and women's health when your salespeople are going to visit the stakeholders described before. And also I want to tell you that we are working together with our marketing department in Cardiff, a new EKF website dedicated to maternal and women's health, where we will not talk only about products, but we want to make also some education to the salespeople, to our distributors, together with the physicians that will go into our website, together with the pregnant women, because also pregnant women should know how it is important to measure the lactate at the time of birth, for example. And remember to go into our EKF Support Center. That is a fantastic tool for you where you can extrapolate each sales and marketing flyers, user guide, training presentation, movies about our device. So I really encourage to do not forget to go into our EKF Support Center. The 2015 challenge that will help EKF to increase the brand awareness along the maternal and women's health, and so you are part of our partnership, is that we create an international advisory board composed by several hospitals in Italy, UK, Germany, Spain, Romania, France, Poland, and also 3 ones in Argentina, Uruguay, and Brazil, because this advisory board agreed on a lactate protocol to demonstrate again that lactate is an additional marker for dysfunctional labor and dystocia, together with the other clinical and echographic evaluations. As soon as the new device for lactate, the name is SensPoint, will be CE mark, we will start immediately this international advisory board, this international lactate protocol. I wanted to stress for the distributors to work with local NGOs organization, because the NGOs organization are extremely really pay a lot of attention in those kind of rapid tests, easy point of care testing, in order to reduce the child mortality and improve the maternal health. So don't forget to work with local NGO, because they are really looking for partners that are able to provide fast answer with easy to use device that can improve immediately the patient health care. And don't forget that our point of care can impact the mother and child outcome. I want to show this slide just to understand how important is a device for the lactate measurement. Today, into the hospital, the lactate measurement in generally has been done through a blood gas analyzer, but with exception of the very rich hospital, not all the hospital got the money to have a blood gas analyzer into the maternity ward. So we choose the sample pathway with the blood gas analyzer. We made some research in Europe, and we understood that if the blood gas analyzer is located into the central lab, the pregnant woman that is into the maternity ward at the time of labor, if there are some complications, the midwife should collect the blood. The blood is collected and sending to the central lab. The central lab should run the lactate test, and then the biologist should validate the test, and the result come back to the maternity ward. In some hospital, if you are lucky, this is going to happen in 30 minutes, but there are also some hospitals where this can happen in 3 hours. And 3 hours is extremely long amount of time for pregnant women with complications, with dysfunctional labor. So with a lactate meter, you can place the point of care at the bed of the pregnant women, and the pregnant women can, with complications, the midwife can collect blood or amniotic fluid, and in just in 10 seconds the results are available for an efficient and safe process of the birth. Now my first part is finished, and I will give the control back to Luisa for continue the second part on product training. Thank you for your attention.
Okay, so I have been handed over the screen now. Thanks for joining and welcome to the product training in the Women's Health session. My name is Katja Lemburg. I'm the product manager responsible for SensPoint and DiaSpec TM. And I would like to give you a brief introduction on the applications and also the function of the product. So to start with the lactate measurement, we have two devices for lactate, and as you may know, EKF has a long history in measuring lactate in sports, in professional athletics for performance evaluation. And this is the field where we come from as a company, but during the last 2 years we have been approached more and more by people with clinical interest of application, and especially from the field of obstetrics. And as Simona explained, the company Natec in France has successfully introduced our lactate scout analyzer, the small test strip analyzer on the left, and has already made a good success with this in France. But still, this device has primarily been developed for the sports field and has some specific functions and also misses some other functions for clinical use. So the decision was to develop a new device, the SensPoint, which will be available for CE launch for April or May 2015. And this device will be dedicated for testing lactate in hospital environment and with a special focus on obstetrics. And I will show you how this works. The SensPoint is a portable lactate meter with connectivity functions and can be used on site but connected to hospital or lab information systems. So I hope you can see the video. So as you could see from the video, there are some few steps to set up the device, but in case of an emergency sample, like for instance from fetal scalp, when the time to test is very crucial, you can already do the setup steps in advance and just start with the test strip insertion, and it makes it much quicker. In general, to talk about the monitoring in obstetrics and why would we need a specific device to test lactate on site is that, of course, the number of complications during birth can lead to a decreased oxygenation of the fetus and also to a prolonged pain and injury of the mother. So there are typical complications, and most of them relate to decrease of oxygenation of the fetus. And the standard monitoring that we have today provides very, very limited information, and most of the available information is not objective and susceptible to interpretation errors. And when visiting an obstetrics conference, a doctor described it as being called to a patient who is in a dark room, and the only thing you are allowed is to feel the pulse, and then you should make a diagnosis from that. So that's a very limited picture. And what they do have is the so-called CTG, cardiotopography, and this is a recording of the fetal heartbeat and also the uterine contractions. But the problem with the CTG is that it often shows abnormal signs, and when there is an emergency reaction like a C-section, they find that the fetus was perfectly normal. So with the CTG you find that you have a lot of so-called false positives, means you overreact. And the consequence of this is a very high cesarean section rate, and also with huge variations. So if you see the average cesarean section rate in Sweden is 17%, In Germany it's about 28%, and in Turkey it's up to 48%. And this describes that there is of course a lot of unnecessary cesarean sections that are done, and the number is increasing because people are concerned that there might be a risk of the natural delivery to the fetus, and maybe also a bit of a sake of convenience. But if we see the adverse effects that are related to cesarean sections, it's actually quite can be quite severe. You have normally a prolonged recovery period of the mother, and also risk of anesthesia complication. Of course, they are still very seldom today, but still exist. You also have an increased risk of infection, and especially if you think about sepsis, that is very often in the post-delivery situation caused by infection of the operation of the C-section, and again prolonged hospitalization. And you also have a lower likelihood of breastfeeding, so the fetus does not get the advantage of the natural protection and immunization of the breastfeeding. And you have also a potential adverse effect on the mother's relation with the baby. The baby can have respiratory problems at birth because it does not spill out the water naturally when being compressed in the birth channel. And it has been described that there is also an increased rate of asthma in children that have been delivered with a cesarean section. And as Simona already described, there is of course a high cost burden and increasing cost burden to the healthcare system. And therefore there is a need of safe and objective monitoring tools to guide the delivery and to support clinical decisions during the process of birth. And what you see on the upper right is a recording of the CTG. And I was quite struck that during a meeting with the midwives, only 5 out of 30 midwives could really make a good conclusion and reliable conclusion and interpretation of the CTG. So why measure lactate in obstetrics? Lactate is of course a marker of hypoxia, and during delivery the fetus depends on the mother, on the placental exchange of oxygen and carbon dioxide, so the oxygen supply comes solely from the mother. And any disruption can cause hypoxia, which leads to acidosis, and can potentially cause a long-term neuronal damage to the baby. And it was found in the literature that there are ways to look at the anaerobic metabolism looking at pH or lactate. And it was shown that the pH was only related to respiratory acidosis, while the lactate was more specific related to metabolic acidosis, which is the more severe and prolonged situation, and also clear related to the clinical picture. There are different applications of testing lactate in the obstetrics situation of the delivery. One is the umbilical cord blood analysis, and this is said to give a picture of the acid-base balance of the infant at birth. And it supports decisions about the acute care after the delivery. So the sample is taken from the umbilical cord directly after delivery, and also decision about transfer to the neonatal ICU if that is needed. It's recommended in all high-risk deliveries, and as Simona described, at the moment mainly done on the blood gas analyzer for pH, base excess, and lactate. But there has been a latest publication in 2014 that the umbilical cord lactate is a more discriminating measure of neonatal morbidity than the pH, so that the pH has a lower impact than the lactate. And for the second test is the fetal scalp blood analysis. That's actually a test which is done during the process of delivery when the head of the baby is descending. And in case there is a stop of process or an abnormal CTG, they can take a small capillary sample from the fetal scalp and analyze for pH or lactate. But they found that with the pH they have a sampling error rate up to 20%, and this is mainly due to the higher volume requirements of the test, because if you run the pH you must do it on the blood gas analyzer, and that requires about 60 microliter sample volume, while the test on the SensPoint, for instance, requires only 0.2 microliter of sample volume. And therefore the latest literature and guidelines are in favor of lactate. We see more and more publication coming and asking for lactate in this application. And currently there are still the options of doing the analysis on the blood gas analyzer or handheld, but there is a clear demand for the handheld lactate meter because of the lower volume requirements and the better convenience of handling, especially when thinking of midwives as being the users. The third test, as Simona described, is the so-called amniotic fluid lactate. And it was found in the 70s already that amniotic fluid contains very high levels of lactate. And it was done a lot of research to find out where does this lactate come from, and it was investigated and found that this reflects the degree of exhaustion of the uterus muscle. So like every muscle that is exhausting, the uterus muscle produces lactate and releases this lactate into the amniotic fluid. So the measurement of amniotic fluid lactate can be used to determine the capability of the uterus to work towards a spontaneous delivery. So you can use the lactate level to see if there is an option for a spontaneous delivery, or if the muscle is already so tired and exhausted that this would not work. You could also use the amniotic fluid lactate to judge if a doses of oxytocin is effective. Oxytocin is a drug that is given to accelerate the contractions, and you can even have a situation that when the muscle is very tired and the lactate is already very high, you don't have the positive effect of the oxytocin anymore, but rather the negative effect that it can cause a spasm in the uterus muscle, and then you have to do this in emergency cesarean section. So this is also a positive thing about the amniotic fluid lactate, that you can use it to control the process of birth and also the delivery of drugs to the patient. And you can use the amniotic fluid level to decide if a cesarean section should be performed because the muscle is not capable to process anymore. And the amniotic fluid is constantly generated through the process of delivery, and the samples can be obtained from the glove after routine vaginal investigation. So it's a very non-invasive way of getting the samples. Okay. Features and benefit of the SensPoint. It's very rapid. It's the fastest lactate test strip meter in the market, with only 10 seconds measuring time. It's mobile, it has a rechargeable battery, and it's very ergonomic and convenient to hold and operate, as you could see from the video and also from the picture. And it's, we have very clear instructions on the screen telling you what to do, and also a validation of the results. If they are out of range for certain defined limits, you will get an information of the validation of the results. The device can be connected to the lab information system, and it's using the common standard POC1A. So that can easily be achieved. And it's also very economic and comes with low costs of reagents and investment, especially compared to the blood gas analyzer. If we look at the competition, the most common device that you will find in the delivery ward is the blood gas analyzer. But the blood gas analyzer, as Simona described, has a long measuring time. Even if the device is available on the ward, it still has a measurement time of 2 minutes, which can, especially in the situation of a fetal scalp sample, almost be too long. And when you don't have the blood gas analyzer in the delivery room, it may take 1 hour or longer to get the sample back, and then for fetal scalp it makes no sense. The result just comes too late. You have a very high volume requirement, 50 microliters, and it's also that lactate is the most expensive parameter on the blood gas analyzer, and just the lactate analysis costs about 5 to 7 euro in this program, and that's why many blood gas analyzers don't offer lactate because of cost reasons. And of course the blood gas analyzer requires a higher degree of training and maintenance. It's not a device that is easily be handled by midwives. Another competitor that we see in the field is the company Nova, and the Nova StatStrip. That is a device which is kind of similar to the SensPoint, but it has some restrictions. For instance, it's only approved for venous and arterial blood, but not for capillary, so you could not use it for the fetal scalp, for instance. That would be out of label use. And as you can see on the picture it has a reflecting display with very small fonts, so it's not very convenient to read. It's also more heavy and less ergonomic than the SensPoint. It weighs almost twice as much, and it has a quite complex user interface. The third device that has been quite common in the delivery ward is the so-called Lactate Pro 1 from Acre, but this device has been discontinued in 2012, and soon the sensors will also become unavailable. They only have a few more months to go. And we see more and more customers turning to us and asking for Lactate Scout or SensPoint as a successor model, because they know they will not be able to use the Lactate Pro in a few months. And the successor model is on the Lactate Pro 2, which is on the market, is not any approved for medical use. It's only approved for sports use, so it cannot be used in the clinical setting. Okay, so that was for lactate. Brief run through of hemoglobin. The Diaspec TM is our hemoglobin analyzer for point of care that we recommend for the use in maternal and obstetrics. And I will not talk in detail about hemoglobin, just focus on the differences with specificity to women's health. And if you think of the iron is an essential part of the hemoglobin molecule, and that's about 70% of the body's iron is found in the hemoglobin. So iron is very essential to build hemoglobin molecules. And the hemoglobin molecules are transporting the oxygen to the tissues, binding oxygen. And if you see that an adult man has about 1,000 milligram of stored iron, which is about enough for 3 years, and the women only have about 300 milligram, which is just about enough for 6 months. So despite having higher natural demands of hemoglobin, women have a natural disadvantage of having lower storages of iron. And when the iron storage are depleted, you will see that the hemoglobin levels are decreasing. And this is causing anemia. Anemia is a reduced number of red blood cells or reduced availability of hemoglobin, and can be caused by 3 different situations. First situation by blood loss, like heavy menstruations, or as Simona described, postpartum hemorrhage, bleeding after birth. Can also be caused by decreased or faulty red blood cell production, and this is often, or in the most cases, related to nutrition deficiencies. In the main cases, this is iron, but can also be deficiency of folate, vitamin B12, and vitamin A. And it can also, of course, anemia can be caused by diseases related to the destruction of red blood cells, for instance, malaria, infections, or parasites, or HIV. So these are the common causes for anemia. And the main patients at risk are the women in the childbearing years because of the loss from menstruation, and also they need an increased blood volume during the pregnancy, when the blood volume needs to be increased by about 40 to 50% to supply the fetus. Children are at risk of anemia because they have an increased need for hemoglobin to manage the growth, to supply enough hemoglobin. And they can also, of course, be in children or grown adults, inherited hemoglobin malformations like sickle cell or thalassemia, which can also be very critical already in the young age. And another problem is, of course, the poor nutrition schemes, and this can be either related to insufficient nutrition in very poor and developing countries, but can also be related to diets that are just too low in iron, folate, or vitamins. And the adverse effects of anemia are fatigue mainly, reduced physical productivity and work performance, and increased mortality and morbidity in the mother and baby, and increased risk of miscarriages, stillbirth and prematurity, and also low birth weight. And for the children, it's a deficit in development and learning in the course of development. And if you think anemia affects about 25% of the global population, but it can be up to 75% in women in developing countries, and even in the industrial countries, it's the only nutrition-based disease that is found in the industrial countries, with about 18%. The Diaspec TM analyzer from EKF is the fastest hemoglobin meter in the market. The measurement time is just 1 or 2 seconds. It's a very easy to handle device with the symbols with a menu based on symbols. The cuvettes are reagent-less, and this is that they are not affected by humidity. And the great advantage of this is that they have the same open shelf life. They don't need to be protected in special bags. You can just take a few, put them on a table, no matter of the conditions, can be even in tropical climate, and there will be no effect on the quality of the measurement. So, and the storage time is above 2.5 years. And especially for maternity sites, which or gynecologists, which often have a relatively low throughput of samples, they appreciate that the cuvettes have a very long shelf life. The measurement range is about from 0.3 to 5.5 gram per deciliter. And the devices are factory calibrated, so the user does not need to worry about calibrations or recalibrations. The integrated battery lasts for about 40 days of mobile operation, and during that time up to 10,000 tests can be performed. So that's about the longest time I have heard of any rechargeable battery in a point-of-care hemoglobin device, the longest time of operation. The device has no moving parts and just needs a very simple cleaning procedure. And compared to competitors, we have a very good price point, and the consumable costs are also low compared to the competition. I will try to start the video. Sorry. Hope that works. No, it seems that this video link didn't work out. Anyhow, if we compare the TM to the competition, you will see that the HemoQ201, which is a typical competitor in the obstetrics and gynecology market, is by far more expensive than the DiaSpec TM. The reagents in the HemoQ cuvettes are susceptible to humidity, so they have a very short open shelf life, and you must be very careful to just take out the cuvettes for immediate measurements. The device is more bulky. It's also twice the weight of the TM, the DiaSpec TM, and the battery has a shorter shelf life. It has only 40 hours of operation, mobile operation, against the 40 days that we have on the DiaSpec, which is especially for field testing in rural countries a very good advantage to have this long time of operation on the battery. We see more and more non-invasive devices coming up as competitors, and this is mainly the companies Massimo, Sens, and MBR. And they are using finger clips, and you need to be careful to select the right size of the finger, and if you think of pediatric patients, that can be an issue. The measurement can be affected by nail polish, low local blood circulation, which is also a common problem in women, and also by body movement, which you have especially in infants. And it's therefore limited in the use of, to the body weight, and the Massimo system, for instance, cannot be used in infants below 18 months. And also you have a higher cost of investment for the devices and higher price per test, and it's difficult for this system to achieve a good price point at sites that have a very low test volume. Another system that is competing with DiaSpec TM in the maternal settings is, of course, the full blood count, CBC, which is often done because they have the device anyway and they are interested in other parameters maybe. But the CBC requires a much higher degree of training and maintenance. It's not mobile, and you need to transfer the sample to the lab and have a much longer measuring time because of the transportation delay, and of course also very high cost of investment. Okay, so this was the presentation. I will try to start the video for the DiaSpec from another presentation, and I hope it will work from there. So I hope you can see the screen now. Okay, that was it. It's the fastest, as I said, that is on the market at the moment. And so I'm handing over to Louis now. Louis, if you take back the screen.
Okay, I'll pass to Diane.
My name is Diane Marshall. I'm going to introduce you to the Chromatocrit Plus, quite an interesting new device that you will be able to sell. What is it? It's actually a system that measures the amount of cream or fat in mother's milk and then estimates the calories. And why would you ever want to do that? Well, as you know, pardon me, nowadays we can have very low weight preterm babies that are actually, they're able to grow and thrive and live a healthy life. So what this does is it lets us manage the milk that the mother produces and what is actually fed to the infant so that we can maximize the calories and also maximize the weight gain. Unlike formula, the fat and calories in mother's milk varies drastically from woman to woman and also with just one woman. Sometimes of the day, like first thing in the morning when she hasn't pumped all night, she will have a large volume of milk but very low calories. Later in the day, the cream or fat usually rises, so you have higher caloric content. However, just in one pumping session, the calories in the milk can vary. When the milk is first coming out of the breast, it will be very low calorie, low fat. And as the breast empties, it becomes richer and richer. So in order to, if the milk is tested by a certain mother and the lipid content is low, then the clinician can recommend strategies to concentrate the calories, to get the baby the best calories. And the mother's milk can be retested after she tries the strategies to ensure the milk is where it needs to be. If you think of a premature baby like you see in the picture, just think how small they are. They fit in the palm of an adult hand. Can you imagine how small the stomach is on that little infant? They want to grow that infant as quickly as possible and get it off of tube feeding, which can introduce infection. So typically what a hospital will do will be to feed the baby, weigh the baby, feed the baby, weigh the baby, and begin fortifying the mother's milk based on if the weight gain is what they're looking for. But with this, we can actually test the mother's milk, make sure she is capturing the most calorie-dense milk. That's what she brings to the neonatal ICU, and that's what's fed to the child. Not only that, but the neonatologist knows the amount of calories that the milk has. So he can fortify or not fortify based on a baseline measure of what the baby's getting. So how would that work? Well, one process that a hospital could use is they can send the mother home and say, every time you pump, fill a bottle of milk from one breast, and then mix that sample well and pull out 1 ml of milk, label it the date and time, and do this every time that you pump during a 24-hour period. Then she brings all those containers to the hospital, probably 8 to 10, let's say, brings them to the hospital. The hospital can then run each sample on the chromatocrit and determine the calories in each sample. They can also see, okay, this mom has the densest calories in that evening feed. And not only that, they can see the average calories at every pumping. They can also pool all that milk and see the average calories that mother's actually producing. Then they can tell her based on that, we want you to capture the milk at the evening feed, and that's in the evening pumping session. That's what we want you to bring to the neonatal ICU. That's what we're going to feed your baby, and then they can test it each time. So there's a number of ways to engineer the lactation. It's actually called lacto-engineering. You're engineering the lactation to best suit the child and grow the child effectively. So let's see how this works. First of all, you fill a chromatocrit tube 1/2 to 3/4 full of milk, and then you seal one end of the tube in a sealant. Then you place up to 6 tubes in the rotor, and the spin time is 3 minutes. After you've spun the tubes, you can take the first tube out and lay it on a tray that's on the front of the device. And then, as you can see on that second graphic, you would press enter to read the tube. And see how the tube looks after the milk's been spun. If you look at the bottom picture, you can see how the sealant is to the left. Then you get a very watery looking section of the tube, and see that thick column to the right? That's actually the cream column. That is because when it's spun, that cream rises to the top. So what you do is you just move your slider to mark the interfaces on the tube where the sealant and the watery milk meet, where the milk and cream meet, and when the cream and air meet, and then the results display. It gives you the chromatograph measure, which is actually the percent of that sample, which is fat and calories, the calories per ounce, the kcalories per milliliter, kcalories per liter, and fat grams per liter. Where would you sell this tool? Absolutely, the primary place is going to be the neonatal ICU, and let's grow those babies quickly. Get them out of the NICU a little early and perhaps save a lot of money by chopping a day or two off of that stay. Also, lactation consultants can use this to promote breastfeeding, and also it's not just a preterm low-weight baby that could use this device. You have babies that are full-term, normal weight, who maybe don't grow as quickly as possible, and then it can certainly be used in that instance as well to get them back on track and growth. The supplies you would need are your chromatocrit plus tubes, tube holders, and those are just simply a tube holder that's used over and over that hold the tubes as they spin. You have the tube sealant, and then optional accessories would be the rechargeable battery pack, so you don't need to plug it in, and also carrying cases. And that is it for me.
Okay, I'll pass back to... Okay, passing back to Simona.
Yes. So, I know that probably you are a little bit tired, but these are the real final slides. A couple of ones are dedicated to pregnancy rapid test. Target markets are hospital, obstetric ward, emergency room, laboratory, reference lab, physician office lab. The brand are Cupid line that is preferred by hospital and abortion clinics with higher sensitivity and performance. And True 20 is a more economical packaging with comparable results with high volume and accounts. And however, you can capture all the information at page 35 of our product catalog. Both pregnancy tests are clear waived, positive results in 10 seconds, greater sensitivity and specificity greater than 99. Individually packaged tests include everything ready to perform to test with extraction on the pouch, and shelf life typically 18 months since manufacturing date. Regarding gestational diabetes mellitus, as I said before, we have the StatSite and BHB, that is a rapid test. Target markets for hospital, obstetric ward, emergency room, laboratory, reference lab, physician office lab. It's a device for the rapid, just in 80 seconds, rapid result, rapid measurement of beta-hydroxybutyrate that accounts approximately 78 of the 3 ketones antibodies, acetoacetate, and acetone on urine. And then we have collaborative tests that are our semi and fully automated point of care for the monitoring of HbA1c for pregnant women in case of gestational diabetes mellitus. Now, if you can see on the right, left, you can type the questions that you have for me. I want to give you a couple of minutes to think about each question that you would like to do at the moment, and I'm really happy to reply to you. And however, after the webinar, I want to tell you that you will receive from myself a recorded webinar link to be sent to all the people of your sales organization that unfortunately did not have the chance to attend this webinar. And I will send to you also a questionnaire, because of course we tried to do our best. but really I appreciated if you can come back with a satisfaction questionnaire. If you had other things to learn, I will be happy to provide you. The important is, again, we are here to build a win-win situation together. So please be free to ask each question or needs that you have, and I will be happy to support.
So, Simona, some of the questions that came through, I had one here asking, is the SensPoint analyzer CE marked? If not, when will it be CE marked? Can you answer that question?
Yes, we are following the CE protocol just in this moment. We expected, like Katia said, to have the CE mark April-May 2015.
Okay. And then there was a general question that came through regarding these slides. Will we be able to make these slides available to people post-webinar?
Yes, absolutely. A PDF file will be created and sent to you.
Thank you.
And one thing more, we showed some movies. Of course, you can download again the movies from the EKF Support Center, and the Chromatography Plus is a video that we are working on just in these days. So it will be available early March. More questions?
Is it worth us mentioning what kind of marketing support that we can provide to help anyone that wants to build the presence in the women's health market in 2015?
Yeah. If in terms of products, again, you have everything that is needed just going into the EKF support system. You have everything. You can download the marketing flyer. You can download the studies that we did, publications, training material. You have everything by product. Again, we produced a brochure just for women's health that your salespeople can use in front of the stakeholders that are daily visiting to show how our products are running and the key features, making some comparison versus competition. And you can also use very soon the new website that we are improving, just dedicated to maternal and women's health. Of course, at the time of the commercial launch of SensPoint, we are working on a series of publication and article to make noise worldwide. In fact, we will have a workshop in next FIGO. FIGO is the World Congress for Obstetrics and Gynecologists that will happen this year in October in Vancouver, and we will have a workshop with the worldwide KOL because SensPoint is a unique product and is the first product available on the market to test different sample types, blood, venous, arterial, and capillary, and amniotic fluid. So we have this unique product, and according to me, we have to make the right noise to support the commercial launch. And don't forget that for the International Advisory Board that will work on this lactate protocol worldwide, we will make another publication early 2016. But last but not least, it's really interesting to work together. If you find a local obstetric and gynecologist event, please contact me because we can work together, increasing the brand awareness of EKF and you as our best partner for maternal and women's health. So work together on local events that you consider are successful to sell more. Other questions?
I think that's everything.
Okay. Okay, so I will send to you the recorded webinar, the questionnaire very soon, and thanks for your attention, and thanks for the support provided by Luis, Katia, and Diane, and I hope that with this webinar will satisfy your needs to sell more into maternal and women's health. Thank you again to attend this webinar.
Thank you.
Thank you.